Hello everyone, my name is Cecil Zuhaib and my today's topic of presentation is drug affecting on reproductive system. Here is a general review and the diagram of male reproductive system and female reproductive system. You can see clearly the difference between male and female reproductive system. The gonads of females are ovaries while the gonads of males are testes. Gonadotropin releasing hormone, luteinizing hormone, follicle stimulating hormone is the hypothalamic receptive stimulates or senses of both luteinizing hormone and follicle stimulating hormone within the interior pituitary gland and their secretion into the blood. You can see hypothalamus results into the releasing of hormone while that hormone release interior pituitary stimulate interior pituitary releases LH, FSH, PRL, TSH, ACTH and GH. These all hormones are released from the interior pituitary which is stimulated by the hypothalamus. So these hormones are basically stimulated and released by hypothalamus. Male reproductive system, a male who has reached puberty will produce millions of sperm cells every day. Each sperm is extremely small, only 0.05 millimeter long. Sperm develop into testicles within a system of tiny tubes called seminiferous tubules. A man produces sperms every day, but a full sperm regeneration cycle takes over 64 days, which is a process called spermatogamy. Female reproductive system. An egg is normally fertilized by the sperm cell in the fallopian tube. Within 9 days of fertilized egg move down the fallopian tubes into the uterus. It then attaches to the wall of the uterus. After the fertilized egg implants, the growing placenta starts releasing HCG into the blood. Some HCG also gets passed in the urine. HCG, human chorionic gonadotropin, can be found in the blood before the first missed menstrual period that can be early as 6 days after the egg. Here you can see the cycle of ovulation and the implantation from the day 1 to the day 4 and then to day 7 where this egg is implanted in the wall of the placenta. You can see how fertilization occurs and then a fertilized egg is converted into zygote. Then that zygote implants in the wall of the placenta in the 7th day and then this zygote converts into the embryo. Here is the chart from 1st to 3rd week where you can see all HCG levels. The male and the female reproductive system is serve as a continuation of the human reproduction. The human reproduction is a form of sexual reproduction resulting in the human fertilization. It typically involves the sexes. Here you can see the drugs of the male reproductive system: androgens, anabolic steroids, and pudol. Danazol is a synthetic steroid derived from the ethinosterazone. This medication is used in the women to treat pelvic pain and infertility due to the certain uterus disorders and also used in both men and women to treat breast pain and tenderness. The side effects include acne, decrease in breast size, weight gain, oily skin or hairs, flushing, sweats, vaginal dryness, burning, itching or bleeding and nervousness. The half-life of this drug is 3 to 10 hours. This danazole is also known as danocrine. Androgens or depotestosterone, primary hypogonadism, testicular failure due to the conditions such as cryptorchidism, bilateral torsion, orchitis, vanishing testes syndrome, Klinefelter syndrome, chemotherapy or toxic damage that alcohol or heavy metals can cause. The side effects include acne, decrease in breast size, weight gain, oily skin, oily hairs, flushing, sweating, vaginal dryness, burning, itching or bleeding and nervousness. The half-life of androgens are 8 days. Half-life of androgen is 8 days. Anabolic steroids. Oxytocin is indicated as the injective therapy to promote the weight gain after weight loss following extensive surgery, chronic infections or severe trauma, and in some patients who without definite pathophysiological reasons fail to gain or maintain normal weights to offset the protein catabolism associated with the prolonged administration of the corticosteroids and for the relief of the bone pain frequently likely accompanying side effects. Side effects are geriatric patients treated with the androgenic anabolic steroids may be at the high risk of development of prostatic hypertrophy and the prostatic carcinomas. The half-life of anabolic steroids is 9.4 to 10.4 hours, and anabolic steroids have not been shown for the enhances of the athletic ability. Oxytocin are also known as oxandrolone, which is the common name of this drug, which is most commonly used in our market. It has a lot of side effects which are not discussed, but the gain. The other one is erectile function dysfunction. The sildenafil Viagra, when sexually stimulated, causes local release of NO, nitrous oxide. The inhibition of PDE5 by the sildenafil causes the increased level of cyclic GMP in the corpus cavernosum, resulting in the smooth muscle relaxation and flow of the blood to the corpus cavernosum of the penis. In mass, corpus cavernosum is the mass of the erectile penis that lies along the side of the penis and which is located below the pair of the corpus cavernosum, which contains 90% of the blood during normal erection. Side effects are dizziness, headache, blurred vision, abnormal vision, sleep problems, insomnia, running, and stuffy nose. Viagra may be taken anywhere from 30 minutes to 4 hours before sexual activity. The maximum recommended dosing frequency is 1 per day. Here are some drugs of the female reproductive systems: estrogens, progesterones. Estrogens contains estradiols, estrogens, coagulants, fertility drugs, oxytocins. Contraceptives are the names given to the medicines or the other devices that are used to prevent unwanted pregnancy. Contraceptives may be referred to as the birth control. Hormonal contraceptives contain one or more synthetic female sex hormones. Hormonal contraceptives that contains both estrogen and the progestin are called combined oral contraceptives (COCs), while which contains only progestin are called progestin only contraceptives, which are known as POPs. These are the two types of contraceptives which are most commonly used in the world. These contraceptives contains condoms and cervical caps. The generic names for the drospirenone and ethyl erythritol is Genevia, Lorinipia, Niki, Oscilla, and Sida. The mechanism of action is through the suppression of gonadotropin release hormone through the hypothalamus. With the suppression of gonadotropin release, ovarian stimulation and the follicular maturation do not occur, and the estradiol levels are low due to the diminished follicular production. Common side effects includes headaches, changes in the menstrual period, vaginal bleeding between periods, spotting, nausea, especially when you first take voyage, vomiting, floating, and stomach cramps. The normal half-life of this drug is 25 to 33 hours, and the oral tablets has the variants contains 3 milligram 0.02. The generic name, another drug has a generic name levonorgestrel and the ethylene estradiol, and the brand names are Amethyst, Evane, and Balcoltra. The mechanism of action is prevention of the surge of luteinizing hormone therapy, preventing ovulation, but progestins also thickens the cervical mucus and alter the endometrial lining to help prevent fertilization or implantation. Common side effects include nausea, vomiting, headache, abdominal cramps, bloating, breast tenderness, swelling of ankles, or the weight changes may occur. The half-life of this drug is 36 to 13 hours. The oral tablets are 0.9 milligrams per 0.2 milligram. Mirena, levonorgestrel releasing intrauterine system, is a hormone releasing IUD. The first and only hormone releasing IUD that is FDA approved to treat heavy periods, also known as heavy menstrual bleeding (HMB), for up to 5 years in women who choose an IUD for birth control. Mirena intrauterine device is inserted into the uterus by the healthcare provider using a special applicant. Short strings connected to the device extends beyond the cervix into the vagina and allow for device removal. Mirena is one of the very successful methods for the prevention of female reproductive disorders. Now, my dear friends, I will tell you about how we can prescribe a medicine to a patient. First of all, we will write the name of the patient, and then we will write the address of the hospital and address of the patient. Then in the prescription we will write the medicine in the RP, for example Viagra 50 mg, and then we will write the DTT number, which is 4, for example in case of Viagra. Then in the signature we will write about the tablet use and how to use the tablet with the timings. Thank you so much. This was all from my side.
That's all for today. Thanks for your attention.